I think it's been a very productive and meaningful experience for me to be part of this All Programs meeting. And of course, the structured program has been extremely informative. The speakers have been great.
We need to build a pipeline for the health professions that brings the diversity of America into our health professions. And that means we need to reach out into our communities to provide role models, to provide opportunities that bring people into health professions, that will excite them about the possibilities, that will prevent them from making academic decisions in the 6th grade, that will cut off their opportunities for the future.
This was an observation made by Matilda White Riley, and was that we're now doing education, we do some work, we take a little time off, we go back to school, we do some more work, take some more time off. But even that is not sufficient to explain how we work these days. We do all these things all the time. We are multitasking workers, learners, and recreators.
Well, the first thing that comes to me is that we've got to look at this no longer as just our local, statewide, national issue. It is a global issue. And that if we're really going to look at new paradigms for learning and education, it's got to be done within the context of the global nature of everything at this point in time.
The number of people who are currently certified as geriatricians, so that's 7,100 people, okay? That's, what, 6 times the number of people that are in this room, okay? Think about that, for 35 million people over the age of 65. And if you look at projections for how many geriatricians are going to be needed, based on the number that I told you, we're not going to make it. So there are going to be a lot of jobs in long-term care. They're projected to be 1.5 million jobs by 2010, 800,000 for nursing assistants, home care workers.
Are we there yet? Are all those different disciplines and all those different programs there yet in terms of achieving that vision of producing a healthcare workforce that provides the highest quality healthcare for all?
Is what we are doing effective? Does it make a difference, and a substantial difference, in improving outcomes as we define them? And then the other side of evaluation, again, this is really sort of the yin-yang approach, is to improve the way that an intervention or program works. How could we make what we do better? How could we learn from both successes and failures in a spirit of continuous quality improvement?
Oh, the meeting itself is just so wonderful. It's already surpassed all of my expectations. I think it's an excellent idea to bring all grantees together, to let them talk and collaborate and refresh themselves. You get to tell war stories, you get to listen to successes and failures, and get ideas of new initiatives that you can do in your own school.
This coordination and collaboration and providing these interdisciplinary linkages with one another is a significant opportunity, for us to make an even better, AHEC system throughout the country.
Well, the most positive thing about the conference is the ability to interact and form relationships with other common grantees, sharing common interests and problems, that how we are able to work around those.
This is what I really want you to get from these 2.5 days. We have learned a whole lot from you, and I want to thank you for being so candid. And quite frankly, meeting with you all has improved our communication within the Bureau. We had to think holistically about our Bureau and what your interests might be, and how we create a venue so that we could address all of your interests, not just those that are specific to a program or an activity.